It's 5:44. You know, D.C. not on the same page when it comes to getting your family a coronavirus vaccine. President Trump openly contradicted Centers for Disease Control Chief Dr. Robert Redfield.
Dr. Redfield told Congress that a vaccine would not be widely available to the public until next summer. However, the president insists that we will see one as early as October. The president also has disagreed with the doctor after he claimed that masks were the most powerful public health tool for fighting the virus.
Okay, number one, is not more effective by any means than a vaccine, and I called him about that. Those were the two things I discussed with him. And I believe that if you ask him, he would probably say that he didn't understand the question.
The CDC director responded, tweeting that, quote, "The best defense we currently have against this virus are the important mitigating efforts of wearing a mask, washing your hands, social distancing, and being careful about crowds."
Joe Biden says he trusts a COVID-19 vaccine, just not one being overseen by President Trump. He said this after being briefed on a national vaccine. Now, Biden says there are specific questions that have to be answered before it's distributed. He's demanding that any vaccine distribution be cost-free and without favoritism. Biden also took time to hammer in his views on mandating masks nationwide if elected president.
Well, there's a new plan for how the government will get a COVID-19 vaccine into the hands of Americans once it's available. The CDC's outline suggests the vaccine would be available about 24 hours after the Food and Drug Administration signs off on it. Healthcare workers and people who are most at risk would be likely first to receive it. The government says it's picking up the tab on that vaccine itself, but experts say it is hardly free.
And it's also important to remember that it's not really free because we're paying for that with our taxes, taxpayer funds that are using it. And then there may be, for those who have insurance, the insurance may be billed for the administration costs.
Although no formal priority plan has been released, states and cities have 30 days to get their own distribution plans that include vaccine sites submitted.